Hi, welcome back to LP Human Anatomica. In the third part of anatomical terminologies, I will be discussing on the various terminologies on the movements of the body. If you have not gone through the first part and second part of anatomical terminologies, which is on introduction, subdivisions, planes, relations of structures, okay, relations of structures is in the second part, the rest are in the first part. So I recommend you to go back and watch them. Okay. So coming to the various terminologies pertaining to movements of the body, okay, the movements at synovial joints are divided into four main categories: gliding movement, angular movement, rotation, and special movements. Now, what is gliding movement? In gliding movement, relatively the surfaces are flat, okay, surfaces are flat, and it moves back and forth and from side to side with respect to one another. Okay, so you can see here the surfaces are flat, okay, and it moves in any direction. Okay, there is not one particular direction. It can move from anterior, posterior, or from side to side. Okay, the angle between articular bones, okay, the angle between articular bones does not change significantly. Now in the angular movement, okay, the angle between articulating bones decrease and increase. Okay, so in flexion there is decrease in angle between the two bones or two surfaces of the body, and in extension there is increase in the angle between the two articulating bones or two surfaces. Now here in the first picture you can see the angle here between the two parts of the body is less. Okay, so the angle is decreased here. So that is flexion. Now here you can see the angle is more between the two parts of the body. Okay, so the angle is more here. So, and both the structures, both the surfaces of the body are in straight line. Okay, there is no angle formed as in the first picture. So when the angle decreases, we call it as flexion. When the angle increases and it is away from each other, okay, the two surfaces away from each other, we call it as extension. Now, in rotation, okay, so in rotation, a bone revolves around its own longitudinal axis. Okay, we will see what is axis. In medial rotation, anterior surface of the bone of limb is turned towards the midline. In lateral rotation, anterior surface of the part of the body or the bone is turned away from the midline. Now, rotation occurring at shoulder joint cannot be seen, but only could be felt. Okay. Now, what you can do is to feel this rotation. You hold your left arm loosely with your right hand, okay, and now with your elbow flexed, okay, move your left arm as shown in the picture. Okay, now move your left arm. You can feel the movement in the arm, okay, in your right hand. So you can experiment in your body, okay, this movement, rotation, how it occurs. Rotation cannot be seen, it can be felt. So, or you can move your head towards one side of the body, okay, so that is rotation. If you move your head towards your left side or the right side, that means you are rotating your head. Okay, so here when the arm is close to the body and you flex the elbow, okay, you are flexing the elbow here and when the forearm is close to the chest. Okay, this is called as medial rotation. Now when the forearm is away from the body, okay, away from the body towards the lateral side, then we call the arm is rotated laterally. Okay, the movement is occurring at the shoulder joint. It is not occurring at the elbow joint. Okay, so please experiment this in your body and see. Okay, the movement is occurring at the shoulder joint. You can even hold your hand at this position. Okay, and you can move your arm and see the or feel the movements here. Okay, occurring at the shoulder joint and not at the elbow joint. I hope this is clear. Now coming to the special movements. Okay, special movements occurs only at certain joints. Okay, for example here the special movement is shown in the arm, forearm. Okay, not at the arm region, forearm region. So the different movements occurring at different joints is pronation and supination at radio-ulnar joints in the forearm, protraction and retraction at temporomandibular joint in head and neck, inversion and eversion at subtalar joint in the foot. Okay, these are some of the examples for the special movements. It is specific only to that joints. Okay, it is not seen in any other joints of the body, so that is why it is called as special movements. Okay, if we take flexion, flexion occurs in different parts of the body, extension occurs in different parts of the body. Okay, so it is not occurring at one joint, it occurs in different joints. Okay, more than one joint. So here for example, if we take the supination and pronation, this is where the palm is facing upwards. Okay, we call it as supination. When the palm is facing down, okay, when it is directed downwards, we call it as pronation of the forearm. Okay, so movements at any joint, okay, it takes place around an imaginary plane called axis. Now an axis is an imaginary straight line, okay, around which the rotation of the object take place. Okay, so it is an imaginary line, okay, around which the movements are occurring. Okay, there are three axes, antero-posterior, okay, through which abduction and adduction, protraction and retraction can occur. Horizontal axis where flexion and extension can occur, and vertical axis where medial and lateral rotation, pronation and supination, elevation and depression can occur, okay, along the vertical axis. So at any given joint there can be one or two or three axes around which the movements can occur. Okay, so we will go through the terminologies pertaining to each joint of each region. Okay, so going through the movements, okay, in the upper limb, okay, it differs at each joint. We will start from the proximal to distal part of upper limb. Okay, so at the shoulder joint, okay, at the shoulder joint, abduction is when the arm is taken away from the body. Okay, so here you can see the arm is away from the body, so that is called as abduction. Now adduction Okay, before going into adduction, we will see another movement of the upper limb, which is elevated, okay, elevated above the body and close to the head and neck. Okay, so you can see the arm is close to the head and neck and it is elevated away from the body. So this we will call at over abduction. Okay, so this is the picture which is showing over abduction of the limb, upper limb. Okay, now adduction is when the arm is close to the body. Okay, you can see the arm is close to the body, which is opposite to abduction. So in this lower picture, you can see the arm is close to the body, but the forearm is away from the body. So still we call it as adduction. Okay. So arm is in adducted position. Okay, whether it is in the medially rotated form or laterally rotated form. Flexion at the shoulder occurs if arm is taken towards the front of the chest wall. Okay, so you can see the arm is present in front of the chest wall. So that is flexion. Extension is the arm is taken away from the body, okay, directing backwards and laterally. So that is called as extension. Medial rotation of the shoulder occurs when the arm rotates medially, bringing the flexed forearm, okay, in front of the chest wall. Okay, so we have discussed this in detail, okay, in the general movements. Okay, so you can do the same experiment again, okay, to check how the arm is rotating. Lateral rotation is occurring at the shoulder joint, okay, when arm rotates laterally, taking the flexed forearm away from the body. Okay, when it takes the forearm away from the body, we call it as lateral rotation, okay, which is again occurring at the shoulder joint. Okay, now there is one more movement which we call circumduction. Okay, this is the movement of the arm in a circle, okay, with extended or flexed forearm. Now when you imagine a cricketer bowling a ball, okay, so in that imagination there is a combination of the extension, abduction, flexion and adduction, okay, in a sequence. So if the movement is occurring in combination of extension, abduction, flexion and adduction, okay, so at a time in sequence we call it as circumduction. Okay, now to see the movements in the upper limb at the elbow joint, okay, flexion occurs at the elbow, okay, when forearm is brought in close relation to the arm. Okay, so you can see the angle is reduced here between the forearm and the arm. So that is the flexion at the elbow or the flexion of the forearm. Now extension of the forearm is the forearm is taken away from the arm. Okay, it is moved away from the arm and you can see the angle is increased here and the arm and the forearm is in straight line. Okay, so the forearm is in extended position or the forearm is extended at the elbow joint. Okay, radioulnar joints. Here, these joints are present in the forearm. Okay, you can feel two bones. When you feel the forearm, you can see two bones. So the movements are occurring within those two bones. Okay, so here supination is the movement which is occurring at this forearm level. Okay, the two bones which are present in the forearm. So when you face the palm directed upwards, okay, in the position where the palm is directed upwards, okay, as in the beggar's hand, we call it as supination. Now pronation is like the palm is facing downwards, okay, it is directed downwards. So when it is directed downwards, it is called as pronation. Okay, like in giving something to anything to the other person, okay, or you're dropping any structure down. So that position we call it as pronated position. Okay, we call this as king's hand. Always giving something to others. At the wrist, okay, at the wrist, okay, the movements occurring are extension, flexion, medial and lateral deviation. Okay, it is not rotation, it is deviation. Now flexion, it occurs when the palm comes close to the forearm. Okay, so the angle between the palm and the forearm is decreased. Okay, so that is flexion at the wrist. Extension, you can see the angle is increased between the palm and the forearm, and the angle between the dorsum of the hand and the back of the forearm is decreased. That is the extension of the wrist. Okay, where the palm is going away from the forearm, anterior part of the forearm, and it is getting closer to the posterior part of the forearm. Now ulnar deviation is you take your palm, which is towards the little finger, close to the forearm. Okay, so that is ulnar deviation. And radial deviation or lateral deviation, okay, is when you take the part of the hand which is close to the thumb towards the forearm, okay, and the angle decreases between the lateral aspect of the forearm and the lateral aspect of the hand. Okay, we call it as radial deviation or lateral deviation. Here ulnar deviation is also called as medial deviation. Now coming to the movements occurring at the metacarpophalangeal joints and interphalangeal joints. Metacarpophalangeal joints are the joints which are present between the palm and the fingers. Okay, so when you flex or when you make a fist of the hand, you can see the knuckles which are protruding, okay, from your dorsum of the hand. So that knuckles are occurring at the metacarpophalangeal joints, and the other joints, you can see two joints, okay, in the fingers. So when you flex, you can flex your fingers at two joints. They are called as interphalangeal joints. Okay, do this experiment in your hand and see. So the movements occurring at the fingers and at the thumb are different. Okay, we will see the difference one by one. Okay, so adduction of fingers or digits. occur when all fingers are present together. You can see all the fingers are together. So that we call it as adduction of the medial forefingers. Now abduction of fingers or digits occur when all the fingers are away from each other. Okay, when all the fingers are away from each other. Okay, now to when you do this, when you experiment this in your hand, okay, you can observe that middle finger is not moving. Okay, when you bring the fingers close to each other and move it from each other, okay, away from each other, the middle finger is not moving. You can see the other fingers moving. Okay, so this we call it as axis. That is, the middle finger is forming the axis of the hand. Okay, for the other movements to occur. So that is the adduction and abduction. Now flexion of fingers occurs when the phalanges come close to the palm, like making a fist. Okay, so you can see this is the knuckle which is forming at the metacarpophalangeal joint, and here you can see the flexed fingers. Okay, the two joints here, that flexion is occurring at the metacarpophalangeal joints. Okay, so this is the thumb where the flexion is occurring at the metacarpophalangeal joint and interphalangeal joint. Now extension of fingers occurs when the phalanges are in straight line. Okay, so when you remove the fist of the hand and make it straight, it is the extension of the fingers. So the fingers are in straight line with the palm. Okay, so that is the extension of the fingers which are occurring at metacarpophalangeal joints. Okay, so that is metacarpophalangeal joints and the interphalangeal joints. Okay, now coming to the flexion of thumb. Okay, here focus carefully. Now flexion of thumb occurs when the thumb is across the palm. Okay, when you take the thumb across the palm, we call it as the flexion of thumb. It is different from that of the flexion of the fingers. Okay, extension of thumb occurs when the thumb is taken away from the palm. Okay, backwards and laterally. Okay, so when you position the thumb along the plane of the palm, okay, we call it as extension. Now abduction of thumb and adduction of thumb, it is a little difficult to get the orientation. Focus. So here in adduction of thumb, what happens? The thumb is in close relation to the palm. Okay, but you can see the position of the thumb. This is the side view of the hand. Okay, when you place the thumb in front of the fingers and the palm, okay, experiment this, do it in your hand. Okay, place your thumb in front of the palm and fingers. That forms the adduction of thumb, and this is also the anatomical position of the thumb. Okay, so during anatomical position, you hold the thumb in this position. Abduction of thumb is you take the thumb away from the palm and fingers anteriorly. Okay, anteriorly and not sideways like this. It will not be in plane with the palm and fingers. Okay, it will be at right angles to the plane of the palm and the fingers. Okay, it will be at an angle, okay, right angle to the palm and fingers. So that is called as the abduction of the thumb. Opposition of thumb, it occurs when it is not seen in other fingers. Okay, so for the thumb, it occurs when the tip of the thumb touches the tip of the other finger. Okay, so when it touches the tips of the other fingers, any other finger, okay, we call it as opposition. Okay, circumduction of the thumb occurs when the thumb moves in a circle, okay, in combination of series of movements, okay, which combines flexion, adduction, extension and abduction simultaneously in a sequence, either in clockwise or anti-clockwise. We call it as circumduction. Now, coming to the movements of lower limb. Okay, so we have seen the movements occurring at the upper limb. Now, looking at the movements in lower limb, starting with the hip joint. Okay, at the hip, okay, adduction. Okay, so that is the hip joint here. So whatever movements occurs, okay, it moves the thigh. So when the movements at the hip occurs, the thigh will move. So adduction at hip or thigh occurs when the thigh is brought close to the median plane. Okay. So when two limbs are together is adduction. Abduction, the two thighs are away from each other. Okay, they are away from the median plane. So that we call it as abduction. Flexion of thigh, okay, is when the thigh is brought close to the trunk. Okay, so the trunk and the thigh are in close approximation, decreasing the angle between the two. We call it as flexion of the thigh. Extension of thigh, you can see the thigh is in the plane of the trunk, okay, in straight line, and the angle is increased between the two structures. So this is extension of the thigh. Medial rotation of thigh, okay, observe this left leg, okay, left limb. Now when you turn the limb medially, okay, so that you will do by bringing your big toe, okay, towards the midline. Okay, so when you point the big toe towards the midline, we call it as medial rotation of thigh. Here also you cannot see the movement occurring at the hip joint. We feel that the leg is moving at the knee joint, okay, which is not so. Okay, lateral rotation is you take the big toe away from the midline. Okay, you turn the big toe away from the midline laterally. Okay, so the rotation is occurring at the hip joint. Okay, where the thigh is rotating laterally. Okay, for that also you have to hold the thigh and move your thigh and see medially and laterally. You can feel the movements occurring at the hip joint. You can feel the thigh moving. Okay, if the thigh moves, that means the movement is occurring at the hip joint. Now coming to the last movement related to the hip joint, okay, circumduction. It occurs when thigh moves in a circle, bringing all the movements simultaneously in a sequence. Okay, that is extension, abduction, flexion and adduction in a sequence. Okay, either clockwise or anti-clockwise. We call it as circumduction. Now coming to the movements occurring at knee joint. Okay, only two movements occur at the knee joint, flexion and extension. So flexion of the knee joint is when you bring the leg close to the thigh. Okay, when the angle decreases between the thigh and the leg. Okay, it is called as flexion of the knee. Extension of the knee occurs when the thigh and the leg are in straight line. Okay, as in standing, or when the leg moves backwards. Okay, when the leg moves backwards towards the ground. Okay, we call it as extension of the knee. The movements occurring at ankle, okay, it includes dorsiflexion, plantar flexion, inversion and eversion. Now dorsiflexion is when the foot moves closer to the leg, okay, decreasing the angle. That is called as dorsiflexion. When the foot moves away from the leg, okay, like pointing the foot towards the ground, okay, and increasing the angle between the leg and the foot, we call it as plantar flexion. And you can observe here posteriorly the angle between the heel of the foot and the leg is decreased. Okay, the angle is decreased here. The angle anteriorly is increased, the angle posteriorly is decreased. So that is plantar flexion of foot. Inversion of foot is the medial border of the foot is raised. Okay, you have to raise your foot towards the big toe. So when you raise your medial side of the foot, we call it as inversion. In eversion, you raise the lateral border of the foot, okay, or the side which is towards the little finger. When you raise this part of the foot, we call it as eversion of foot. Okay, so all these movements occurring at the ankle joint. Okay, so that were the movements occurring in the lower limb. Now coming to the movements in the neck. Okay, in the neck, the movements which occur in the neck is flexion, extension and lateral flexion. Okay, so we will see what are the differences here. So the flexion of the neck is when you bring your chin close to the chest of the body. Okay, when you bring the chin close to the chest of the body, okay, the movement is occurring at the joints in the neck. Okay, so that is flexion of the neck. Extension of the neck is when you move your head behind. Okay, you are moving your head behind, where the posterior part of the head is in close approximation with the trunk. Okay, where the angle is decreased. Okay, we call it as extension. And in the anterior aspect, you can see the chin is almost in straight line with the chest. Okay, so that is extension. Lateral flexion, you either move your head towards the right side or the left side, so that your side of the head is in close approximation to the body. Okay, so you can see this is towards the left side and the right side. So the angle decreases whether it is on the right side or on to the left side. Okay, that is lateral flexion. If it is on the right side, we call it as right lateral flexion. If it is on the left side, we call it as left lateral flexion. Now rotation. Okay, you have to observe the difference between the lateral flexion and rotation. Okay, in flexion you bring the side of the head to close to the trunk, but in rotation you are moving the head towards one side of the body. Okay, you are moving the face to one side of the body, okay, towards the right side or left side. You can see the angle is not changing, okay, as in the flexion. Okay, so here you can see the angle, but here there is no change in the angle. Okay, you are just moving the face to one side of the body, either to the right side or left side. So call it as right rotation or the left rotation. Now movements in the trunk, okay, it includes flexion, extension and lateral flexion. So flexion of trunk is when you bend, okay, when you bend, the movements are occurring at the joints of the vertebral column, okay, which are present in the trunk, in the vertebrae. Okay, so the trunk is moving closer to the lower limb. Okay, the trunk is moving closer to the lower limb. That is called as flexion. In extension, you are taking the body or the trunk away from the lower limb. Okay, and you are bending backwards. Okay, so that is extension. Lateral flexion is when the body is moving sidewards, okay, and becoming close to the lower limb. Okay, so the trunk is close to the lower limb compared to, in comparison to the other side. Okay, we call it as lateral flexion. It can be right lateral flexion or the left lateral flexion of the trunk. Now coming to the arrangement. So those were the terminologies related to the different joints present in different parts of the body. Okay. Now coming to the arrangement of structures in the body. Okay. So are you wondering how the structures would be arranged in the whole body? Okay. So from within outwards. Okay. From within outwards, you can see a core of the body which is formed by the bones, okay, supporting the framework of the body. Okay, so that is the deeper structure in the limbs, okay, whether it is upper limb or the lower limb. But in the thoracic region and the head and neck region, it forms a outer covering. Okay, it covers the important parts of the organs of the body. Okay, so this we call it as endoskeleton, this we call it as exoskeleton. Now covering the bones are the muscles. Okay, the whole body is covered with muscles. So the muscles are attached to the body. Okay, so along with the superficial fascia, the muscles, okay, you can see the blood vessels, the nerves which are present along the muscles and the superficial fascia of the body and the deep fascia of the body. Okay, so we call this as neurovascular bundle because the vessels, that is artery, vein and the nerve, are present together almost always. Now as I told you, okay, in some parts of the body where the skull, okay, the skull, the thoracic cage and the pelvic region, where the pelvis, they all enclose the organs of the body, okay, in these regions. So in the skull, it encloses the brain. In the thoracic region, it protects the heart and the lungs. In the abdominal region, all the intestines, associated digestive organs like liver, spleen, okay, all these are present inside the body, okay. Now the whole body is covered by three layers, okay, or three structures, okay, throughout the body. That is the skin, okay. What we see from outside is the skin. Then deep to the skin will be the superficial fascia, and deep to the superficial fascia is the deep fascia. That is, when we remove the skin, what we see is the superficial fascia, and when the superficial fascia is removed, we see the deep fascia, okay. So that is about the third part of anatomical terminologies, okay. So the whole summary of the anatomical terminologies will be dealt in the next session, okay. See you there, okay. Before you leave, share your lessons learned in the comment box, and give your ratings and reviews in the comment box, whether you like, okay, this lecture, okay. So that is about regarding this lecture, okay. Thank you. See you in the next session, that is the summary section. If you like the video, hit the like button. If you have not yet subscribed, subscribe to the channel and hit notification button. Join my private Facebook community where like-minded students will support, discuss, encourage and push each other towards reaching the goal. For link, visit the description area. Thank you for watching.